How come there's more policemen than people? Because there's more policemen.
I got food.
Hi, everybody.
Hi, Jack!
Hey,
Hi, Jack!
Jack. Hi, Ray.
Gordon, good to see you again.
Nice to see you. Thanks for all your help on the internet. Hey, I'm glad there were a small crowd so I don't have to have everything repeated. I have to express my gratitude for your invitation and for your being here.
Hi, Jack!
I think it's very important. The Occupy movement has changed the nature of the dialogue in America, and it sure needed changing. And it's only because people took to the streets that anything was going to happen, because the media was avoiding all this for oh so long that things have gone tragically wrong. I'm a family doctor in Ocean Beach, and I am here out of gratitude for your energy. I think that the healthcare system is a subsidiary of Wall Street. I represent an organization called Physicians for National Health Program. We are over 18,000 physicians and other health personnel across the United States. One of our staff actually started the Occupy in Washington, D.C., which was previously scheduled before the Occupy movement. Today, Sunday, people from PNHP in New York are giving free flu shots to all the Occupy people in New York City. Our organization supports single-payer health insurance, which is essentially improved Medicare for all, and is predicated on the fact that we have to get rid of insurance companies, which are an agency of Wall Street. And that's why we're brothers under the skin with the Occupy movement. I've got 2 points to make today. One is the menial ripping off of sick people by the insurance companies, and the other is how bad the healthcare system is in the United States. I see this every day in my office. I have about 10% of my practice on welfare, Medicaid, Medi-Cal. I have another 10 or 15% uninsured people. Most of those people used to be insured and used to have jobs. So I see it on a day-to-day basis. Just to give you a couple of examples, last week I saw a fellow who worked as a mechanic who told me he couldn't go to work anymore because the pain in his back was too bad. He's fully insured. And I asked him why he didn't get his surgery. He says, I haven't been able to come up with $100 copay for my MRI, which the surgeon requires. And as soon as I get it, I'll get my x-ray and then I can get on the way to surgery. Meanwhile, he had to stop working. I have a friend of mine who had a heart attack when he was 52 years old. He does communications equipment installing, like telephones and internet, things like that. Because he's a small businessman, he had an affordable health care policy. After he had his heart attack, his pharmacy benefits ran out for the year approximately May 7. That meant the rest of the year he had to pay out of pocket approximately $200 a month for his medications. Since then, he's gone through bankruptcy. His house is in foreclosure. He has a heart pacemaker, and I was able to wrangle a pacemaker check for free from some cardiologists, but he kept coming into my office holding his chest and complaining of chest pain. I did a cardiogram for him for free, and it showed he was in the process of having a heart attack. I gave him the cardiogram. I said, you get on to Mercy Hospital and ask for this doctor, and they can't turn you away. He says, well, what about the bill? I said, you got to live. You can't avoid it anymore. You have to go. So he did go, and he had his stent had blocked up. He needed another heart procedure, and he's alive today due to the goodwill of the healthcare system, not because the system is working well. I really want to start by quoting a statement made by a doctor who I admire very much. He's English, or actually more truthfully Welsh, and this is called the inverse care law. It's written by Julian Tudor Hart, a family doc in Wales. Quote, The availability of good medical care tends to vary inversely with the need of the population served. This inverse care law operates more completely where medical care is exposed to market forces, and less so where such exposure is reduced. The market distribution of medical care is a primitive and historically outdated social form, and any return to it in England would further exaggerate the maldistribution of medical resources. I don't think that's been said any better. That was said 40 years ago in 1971. England has a national health system and we have yet to achieve that. But the problem has been demonstrated in the United States over these past 40 years. Market medicine does not work for the good of the people. And I think that's what the Occupy movement's all about. I can quote for you infant mortality figures. Infant mortality in the United States runs about 6.8 deaths per 1,000 live births. In Japan, after 10 years of recession, it runs 3.8 deaths per 1,000 live births, about half of what it is in the United States. I can quote for you infant mortality by states. Those states which have the most conservative Tea Party Republicans have the highest infant mortality. States like Louisiana, Mississippi, Tennessee, and Texas. I can quote for you the fact that we have many counties in the United States, and if you can see this map, they're in red. Guess what these are? These are counties in the United States where the mortality of adult women is increasing. No small number of places. Grown women are dying faster in these counties now than they did 5 years ago because of the great healthcare system that we don't have. Now, maternal mortality is another thing. Maternal mortality means women who die in the process of giving birth. It's so bad in the United States that Amnesty International wrote a whole report on it. A whole report. The average maternal mortality in the United States is 9.5 per 100,000 live births. In California, it's 17, almost twice as much. African Americans in the United States have a maternal mortality of 33 per 100,000 live births. Speaks to the inequity across the races that we have in this country. So, I can give you statistics after statistics. Here from the Journal of the American Cancer Society, the 5-year survival rate for all people with health insurance is, and all cancers, is 80%. That is all cancers, men and women, all across the United States. 80% of them survive 5 years. However, if you happen to be on Medicaid or have no health insurance, your survival for 5 years for the whole population is 65%. It goes on and on. We have, by some estimates, 40 to 80,000 excess deaths in the United States due to medical conditions which could be treated if we had an adequate health care system. Of course, other countries have good health care systems. Just to quote you some statistics, in the United States we have, I'm going to do admission rates per 100,000 people in 2007. In the United States we had 441, while places like Norway, Denmark, Canada have less than 150. We have asthma admission rates per 100,000 people aged 15 and older. In the United States it's 120. In Switzerland, Netherlands, Sweden, Germany, it's less than 30. We have people who don't get preventive medicine, so they end up in the hospital. This is not only pain and suffering, this is tragedy. And as a matter of fact, we were all around in 2009 when President Obama put forward his plan to change healthcare in America. What did he do? He subsidized Wall Street by putting the plan out that you would all get better if we only had health insurance. As I told about my patients with health insurance at the beginning, The anecdotes show that health insurance is not the same as medical care, and it's getting worse and worse all the time. The cost for premiums, the cost for co-insurance, the cost for deductibles, the co-pays on medications, generally, on the average, in the United States for insured people, amount to 20% of family income. 20% of the average family income in the United States. If the cost of eggs had increased the same amount as the cost of health care in the United States since 1945, a dozen eggs would cost $55. If the cost of a gallon of milk had increased the same amount as the cost of health care, it would cost $48. That's how much health care has escalated and what we pay for it, even though it's inadequate.